Department of Health and Family Welfare, Government of Kerala. Standard Operating Procedure for COVID First Line Treatment Centers, June 2020. Part 1. Introduction. The COVID-19 pandemic has had devastating impact on all aspects of life, especially on the health systems all over the world. States in India are in various stages of the pandemic. It is very essential that adequate preparedness and response measures are taken to face the pandemic and thereby save lives and protect the health system. The strategy of identifying suspects, quarantine, testing and isolation has paid dividends in Kerala state. It is essential that as the pandemic intensifies, testing and isolation of cases needs further support in curtailing the epidemic curve. In the context of COVID-19 pandemic, Department of Health and Family Welfare Government of Kerala has already issued advisory on three-tier patient management system like COVID Care Center, COVID First Line Treatment Center and COVID Hospital. CFLTCs provide institutionalized care and treatment to mild or asymptomatic COVID-positive patients. This level provides essential COVID care as well as specialized care via telemedicine facility linked to the COVID hospital. Definition. CFLTCs are the centers identified as COVID healthcare center to treat all mild and moderate symptomatic persons under surveillance. Aim of CFLTCs: to provide quality primary COVID care to all citizens of Kerala and optimize healthcare resources. Prerequisites of CFLTC. The district health authorities shall identify the CFLTCs in coordination with the local self-government institutions. The CFLTCs should be linked to designated COVID hospitals already established in each district. The following requisites are essential for a CFLTC. The facility should be able to accommodate at least 50 patients at a time, like auditoriums, marriage halls, indoor stadiums, etc. There should be adequate facility for ward-like arrangements or individual rooms with adequate furniture. Facilities for patient care, staff, kitchen and store should be available. Adequate road access should be available. Electricity and communication facilities like internet and telephones, land or mobile, should be available. Adequate toilet facilities should be available at the facility. The CFLTC should have adequate natural light and cross ventilation. This may be supplemented with mechanical ventilation, like fans, exhaust fans, etc. Adequate security services should be available at the CFLTCs. The hub and spoke model, that is CFLTC linked to COVID hospital, should be applied for providing quality care to the patients. The following service delivery should be ensured in COVID First Line Treatment Center. The district administration can identify as many as centers for these purpose as possible. The district administration should make the list of healthcare professionals and post them to the healthcare center. Logistics. Necessary drugs and consumables should be made available. The staff should be trained with the treatment guidelines. All the treatment guidelines and the reference protocol should be printed and made visible in the treatment area. The identified centers should have an observation area, treatment area, at least 10 to 25 beds for observation. The following service delivery should be ensured in COVID First Line Treatment Center. Any center with 10 to 25 beds should have the following staff pattern: doctors 8 in rotation, staff nurse 12, pharmacist 3, cleaning staff 10, healthcare volunteer 6, security 3. There should be an OP register, admission register, inpatient register with symptom checklist for OP and IP cases. Adequate signage should be displayed in waiting area, treatment areas and inpatient area. Daily reports should be sent to district control room. The center should conduct OP till 6 p.m. in rotation, and ward duty and night duty also should be ensured. Triaging should ensure with symptom checklist in front of the OPD. Emergency reporting should be done if any person admitted is found missing from the hospital. Administration. The administrative control of the CFLTC is to be assigned to the hospital superintendent from the nearest taluk headquarter hospital or block medical officer where the CFLTC is located, as decided by the district health administration and the local self-government institution. In case of urban areas, the district health administration shall designate a medical officer in consultation with the health officers and corresponding LSGI. A medical officer designated by the superintendent or block medical officer will be the COVID-19 nodal officer for the CFLTC and shall manage the day-to-day activities of the CFLTC. Duties and responsibilities. The superintendent or block medical officer and the nodal officer of the CFLTC should coordinate with district health authorities and with the corresponding LSGI for the smooth functioning of the CFLTC. The superintendent or block medical officer as per requirement may utilize the service of medical, paramedical staff and public health staff for the critical functional components of CFLTC without affecting the smooth functioning of the government health facilities. CFLTC nodal officer will be responsible for imparting capacity building to different categories of staff. Nodal officer of CFLTC shall coordinate with LSGI and Health Department for procurement and installation of general items and medical items and ensure uninterrupted supply of materials and consumables. Nodal officer of CFLTC should prepare the duty roster for all categories of staff. CFLTC nodal officer should ensure that the registers and records are maintained. A daily report shall be sent to the district by the nodal officer of CFLTC. All medical and health-related administrative files will be channelized through the respective government healthcare institution. It will be the responsibility of the respective ministerial staff to provide required support in this regard. Duties and responsibilities. Doctors provide medical care. All guidelines should be followed. 4 doctors will be posted for 14 days and duties will be divided as 6 shifts. If number of patients increases, more doctors should be posted. Minimum 2 clinical rounds per day shall be conducted at CFLTC and as per the requirement. A psychological assessment should be done during the clinical rounds. Management of comorbidities should also be done. Proper clinical documentation should be made. Staff nurse provide nursing care. 3 staff nurses are to be posted for 14 days and they will take rounds twice along with the doctors, and progress of each patient are being monitored frequently and informed to medical officer or doctor. Proper clinical documentation should be made. Other staff shall perform the duties as per the instructions of the nodal officer or superintendent. Volunteers. The volunteers should be trained and contribute to the activities as instructed by the nodal officer or superintendent. Coordination with district health authorities and COVID hospitals. The CFLTC shall work in proper coordination with the district health authorities and liaison with the COVID hospitals. All communications shall loop the superintendent of the hospital attached. The hub and spoke model advisory shall be followed for the smooth functioning of the system. Admission criteria to CFLTC. Category A COVID positive patients. Asymptomatic COVID positive patients. Thank you for patient listening.